Hi, my name's Arosha. I'm from the University of Queensland and I'm doing a short internship with The Conversation with Phoebe. So I'm just here to see what people at The Conversation do. So thank you for allowing me to be a part of this.
Hello, I'm Nadine. I'm studying Cert 4 in mental health. It's all about empathy, so I'm here today to hopefully improve my empathy once I gain employment in the industry.
Thank you, Nadine.
Hi, I'm Jennifer. I'm a trainer at TMG College and I train the Cert 4 in mental health. Nadine's one of my students, and we came today to be able to share lived experiences for mental health and be able to show my students, what life is like out there, I suppose, with mental health issues, and they can get some learning from that. So thank you for having us.
Thank you for coming.
Hi, my name's Phoebe. I'm one of the health editors at The Conversation. I came along today because I came to the last one of these and it was fantastic. This one is particularly interesting because mental health is obviously hugely important, and access to mental health is, I suppose, driving the crisis, inequity in that access, particularly among different social and cultural groups. So I'm interested to see what sort of insights we can get today and having conversations.
Fantastic, thank you.
Oh, hello there. My name's Ian. I'm a community journalist with Joy, the LGBTIQ radio station, and I'm also a local resident. We covered the Royal Commission last week and spoke to a number of people with lived experience, and I love what Croakey does as well. And my interest is in policy and community engagement, especially around those LGBTQ communities, but all those vulnerable communities and how that links up to a better mental health system. And from what I heard at the Mental Health Commission, there's a lot of work that needs to be done. It's really not working.
Exactly.
Yeah.
Thank you, Ian.
Thank you. My name's Fiona Patten and I'm the Upper House member for Northern Metropolitan. So the North is my region and I go from the Melbourne CBD right to the outskirts, and the growing concerns about access to mental health services, both inner city but also in those new outer suburban areas, is of concern to me. So I'm here to learn what else I can do to advocate for mental health services in my region, but understand, I guess, more fulsomely what services are available here in Northern Metropolitan.
Fantastic, thank you.
Great, thank you. My name's Ryan Shields. I'm from VCOS, the Victorian Council of Social Service. We're here today primarily to listen and to learn, like I think most people are. We look at almost every issue through the lens of poverty and disadvantage, and equally with health and mental health. So I guess, one of the things we'd like to, contribute to the day is that lens and that acknowledgement. We know that mental health affects everybody from every walk of life, up and down the state and indeed all over the world. But what we also know is that poverty and health and mental health conditions are intimately linked, and they can reinforce and exacerbate and cause each other and make each condition worse. So you can't really talk about one without talking about the other, and we know therefore the solutions need to cross over that divide as well. So ultimately, we believe the solution to the challenges facing the mental health system are in the community. They're in community health. The first responders to our mental health system shouldn't be emergency services, they should be community services. So we'd really like to contribute that and listen and learn from what others are going to say today.
Thank you so much.
Good morning, my name's Craig Walker. I'm part of the team at Northwest Melbourne PHN. My role is in corporate services, so facilitating sort of the back of house activities that support a lot of the funding and contracting of providers. So interest here today is really around our envisaged mental health plan for the Northwest, and using this innovative approach to gain a new insight and approach to mental health planning.
My name's Marianne Toy. I'm Director of Strategic Relations at the PHN, and the comms team and I have been working very closely with Croakey Go just to bring a whole bunch of different people that maybe we don't normally make the time to sit down and talk with and to hear their stories, because what we do at the PHN is about integrating services. You can't provide good care for people if all the health service providers aren't working together, and if we don't look at it beyond just medical services, which is where, Ian was saying is that, you can't have good mental health if you're homeless. It makes it very, very challenging. And all those other things like education, training, work, really critical, as well as good physical health. It contributes. So that's what we're trying to do, and I'm really looking forward to, talking with people and learning more about, people's stories. Thank you. And
me. I was hoping to get out of this because I'm just tweeting, but I'm here today to connect with the huge community of inspiring people, and to do it in a digital first way. I think that our attention spans are just shrinking and shrinking and shrinking, so it's really important that we as health progressives, I guess, come together and get our messages out quickly, sharply, and on the platforms that people are likely to watch them on. Thanks.
Great, thank you. How do I turn this off? Oh.
There's plenty commenting before.